This combination medication is used to temporarily relieve symptoms caused by the common cold, flu, allergies, or other breathing illnesses such as sinusitis and bronchitis. Antihistamines help relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing, while decongestants help to relieve stuffy nose and ear congestion symptoms. If you are self-treating with this medication, carefully read the package instructions to be sure it is right for you before you start using this product. Some products have similar brand names but different active ingredients with different uses. Taking the wrong product could harm you. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products, including some long-acting tablets/capsules, are not recommended for use in children younger than 12 years. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms such as drinking enough fluids, using a humidifier or saline nose drop/spray. When taking Sudafed PE day and night 10 mg day/25 Mg-10 NT tablets oral decongestants, it's important to follow the instructions provided by your doctor or on the product package. If you have any questions, don't hesitate to ask your doctor or pharmacist for clarification. If you experience stomach upset, you may take this medication with food and be sure to drink plenty of fluids, unless directed otherwise by your doctor. If you're using the liquid form of this medication, measure the dose carefully with a special measuring device or spoon. Do not use a household spoon. If it's a suspension, make sure to shake the bottle well before each dose. Extended-release tablets or capsules should not be crushed or chewed, as this can increase the risk of side effects. Swallow the whole or split tablet without crushing or chewing. If you're using chewable tablets, make sure to chew them thoroughly before swallowing. If you're using a product designed to dissolve in the mouth, place each dose on the tongue and allow it to dissolve completely, then swallow it with saliva or water. The dosage of this medication is based on the specific product you're using, your age, medical condition, and response to treatment. Do not increase your dose or take this medication more often than directed without your doctor's approval. If your doctor has directed you to take this medication daily, be sure to take it at the same time each day in order to get the most benefit from it. It's important to inform your doctor if your condition lasts for more than 1 week, if it gets worse, or if it occurs with a persistent headache, fever, or rash. These may be symptoms of a serious medical problem and should be checked by a doctor. Some common side effects of Sudafed PE day and night tablets include drowsiness, dizziness, dry mouth, headache, upset stomach, constipation, or trouble sleeping. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist promptly. However, many people using this product do not experience serious side effects. It is important to remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Seek immediate medical attention if you experience serious side effects such as mental or mood changes, ringing in the ears, difficulty urinating, or vision changes. Very serious side effects including fast or irregular heartbeat and seizures require immediate medical help. While a serious allergic reaction to this drug is rare, seek medical help if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. It is important to note that this is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Sudafed PE day and night tablets, it's important to talk to your doctor or pharmacist if you have any allergies to its ingredients, as this product may contain inactive ingredients that can cause allergic reactions or other problems. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have breathing problems, diabetes, glaucoma, heart problems, high blood pressure, kidney problems, liver disease, seizures, stomach/intestinal problems, overactive thyroid, or difficulty urinating. This medication may cause dizziness or drowsiness, and using alcohol or marijuana can increase these effects. It's important to avoid activities that require alertness until you can do them safely. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires you to limit these substances in your diet, it's important to talk to your doctor or pharmacist before using this product. Before having surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Children and older adults may be more sensitive to the side effects of this product, and it's important to be cautious during pregnancy and while breastfeeding. Always discuss the risks and benefits with your doctor before using this medication. It's important to be aware of potential drug interactions when taking Sudafed PE day and night tablets. Some products, such as antihistamines applied to the skin, may interact with this medication and cause serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential interactions. Avoid taking MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. It's important to also inform your doctor or pharmacist if you are taking other products that cause drowsiness, as this medication may also cause drowsiness. Additionally, this medication may interfere with certain medical or lab tests, potentially causing false results. It's crucial to inform lab personnel and all your doctors that you are taking this medication before undergoing any medical or lab tests. If you suspect an overdose and the person is experiencing severe symptoms like fainting or difficulty breathing, it's crucial to call 911 immediately. Otherwise, contact your local poison control center right away. In the US, you can reach them at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Signs of an overdose may include irregular heartbeat, hallucinations, fainting, and seizures. If your doctor has prescribed Sudafed PE day and night tablets, do not share it with others. It is important to keep all medical and lab appointments while taking this medication. If you are using Sudafed PE day and night 10 mg day, /25 Mg-10, NT, tablets oral decongestants regularly and happen to miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, it's best to skip the missed dose and take the next one at the usual time. Avoid doubling the dose to make up for the missed one. It is important to store Sudafed PE day and night tablets at room temperature, away from light and moisture. Avoid storing them in the bathroom and do not freeze the liquid forms of this medication. Keep all medications out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. For guidance on how to dispose of the medication, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.